So in the studio, I have Robin Ebmeyer from our full title. Robin, just tell me.
I'm the Director of Emergency Management and Safety.
Director of Emergency Management and Safety. And honestly, I knew Robin's title because, we kind of meet every single day.
Every day.
But we have Robin here just to give us a quick update on the state of COVID in Utah County and in the state of Utah. Over to you, Robin.
Yes, thank you. Thank you so much. And I'm very grateful to be here to do this. I know I get a lot of questions about, is it safe to be on campus? Especially as we're starting to phase employees to coming back to campus, that becomes a much more popular question. Will I be safe? Am I safe? What's it going to be like when I get there? So I want to talk about a couple of slides here. And to start off with, I guess what's important is that it may be disconcerting or unsettling for people to see that number, that daily positive case number. And it can be unsettling, but what I'd like to share for the next few minutes are a couple of other data points. We look at many data points, but I want to highlight a couple for you this afternoon to just show you that there are some other things that we look at, not just the daily count. So this first slide is what we call the transmission rate. The transmission rate is when one person is ill, how many people do they infect? And we would like that number to be below 1. So right now you can see on this slide that our transmission rate is 1.01. We're just above 1, which means if I get sick, I give it to at least one other person. So what we'd like to see that line, and you can see it's kind of decreasing as it goes down. We'd like to see it below 1, and we are so close to doing that. So that's an important data point to recognize. And we're doing okay. Now, if you look at us in comparison with the entire United States, there are 7 states that have higher transmission rates than we do, and the rest are below us. So there's a big chunk of the U.S. states that are below 1. New York currently is the lowest transmission state, which is interesting, but they've had their peak and they've come down. We have been behind many other states in our case rates. So this isn't a surprising number, and we are headed in the right direction. The next one I want to show you, and this is an important data point, and this shows visits to outpatient clinics and visits to the emergency department. So that orange or red line that you see there, each dot represents the end of a week. So it's not by day, it's by week. And you can see how in kind of that late March, early April, we had a real spike in emergency department visits. The blue line are visits to outpatient clinics. So you can see over time, we've dropped, and kind of leveled out right now. Why that's important for us to know and to look at is because this kind of shows the community anticipating where they need to go for care. And the other point is that we're not overwhelming our hospital systems. We're not overwhelming the ERs. We're not overwhelming our clinics. So that's an important piece of information that we also look at. The next slide is what we call the epi curve. This is an important slide because it takes us away from looking at the daily count, which kind of is fearful for some people, and it starts averaging. So each one of those dots is an average of 3 days. The line kind of flattens that out. So each of the colored bars means a different thing. The orange bar that you see is an increase in incidence. The yellow is a plateau of incidence, and a blue is a decrease in incidence. So you can see for quite a while we were doing kind of flat, which was what we wanted. And you can see very shortly after May 18th, which was the day that most of Utah went from orange to yellow. We knew this number would jump up. It did exactly what we thought it would do. But you can see over the last several days and weeks that we did go up, and we've kind of flattened out. And that slide is as of yesterday. I just looked at today's slide on this, and the next bar is also yellow. So we're in a plateau phase right now, which is good. We don't want to have that growth. But it is also too early to say, are we going to start going down? Are we going to keep going flat? Or are we going to go back up? We just don't know the answer to that. But this is an important graph for us to look at. It helps, for me, it helps take away that anxiety of what is the daily count every day. So let's talk about Utah County specifically. I literally sent these slides in this morning and they changed because that's part of the dynamic environment that we are in. Every day you wake up and say, what's going to happen today and how are we going to deal with it? And this is one of those. The hospitalization rates, meaning those people who are hospitalized because the COVID virus is bad enough that they need extra support, we're doing very well in Utah County. We're doing very well in Utah. But we're definitely doing well in Utah County. The number of positive testing, and this is the number that changed today. So the range for the last 2 weeks or even longer have been somewhere between 33 to 59 positive cases in Utah County. That number changed today to a high of 65. We actually had 65 people who tested positive in Utah County. That may be concerning, but again, you've got to see several days over time for that to be concerning. So that is the highest we've tested in this whole time. But again, remember that there are other data points that we're looking at. Remember the hospitalization. The other piece of important information is that our mortality rate has been dropping. Right now, I put this slide up. I looked at it yesterday. It was 1%. As of today, it is less than 1%, just less than 1% is our mortality rate. And that's the number of people who actually die after they get this virus. So we like that number a lot to go down, and it is going down. This last slide for me is where, the numbers can be unsettling. It can drive fear in us. It can cause us to do things we might not normally do. It makes us feel out of control. And that's the part I want to leave with you today, is there are things we can do to feel in control again. And there's nothing new on this slide, especially on the left-hand side, the precautions. I call this the pandemic big five. You've been told these over and over, but what I think might be important to look at are why. Why do we stay home when we're sick, and what is the outcome? And each one of these precautions reduces our risk. But more importantly, I think it is that it gives us control. I have a little tiny bit of control in my life if I'm governing my ability to do these precautions. I'm sick, I'm going to stay home. Why do I stay home? So I don't infect that one other person wherever I'm going, whether it's at home or at work or the grocery store. I'm going to stay home. I'm not going to infect another person. I'm going to help be a part of bringing that number down. Social distancing. This helps both me and the people I'm around. Decreases the risk in actually passing that virus. Wearing a mask. We have learned so much about that over time. Wearing a mask really is respectful for the people I work with, the people I'm around. It shows that I care about them. And so that becomes a thing I can control. And the outcome is I'm helping the people around me. The wash your hands and don't touch your face. I have absolute control over my ability to wash my own hands and not touch my face. I've become very acutely aware of how much I touch my face and have gotten much better at it over time. Those are things we absolutely have control of, and the outcome for washing hands and don't touch your face is the only way for that virus to get into my body and actually cause trouble is by entering my eyes, my nose, or my mouth. If I learn to not touch my face and wash my hands frequently, then I'm not going to introduce that virus into my body. All 5 of those are important. I feel like they give us control back, a little bit of an environment that feel like maybe we've lost a little bit of control of. We have control over those 5. And each one of those lessens the chance, reduces the risk of us getting the virus and passing the virus. So ending back at that first slide, the transmission rate, all of those help us decrease that transmission rate, which brings this virus in our community under control.
Thank you, Robin. I want to say personally how grateful I am to Robin tracking data and information, and I think her message about what's under our control is really, really important. This is both a technical and a human adaptation issue, and I think that as we focus on these things that are under our control, not only will we feel better, but we're also able to contribute to preventing the virus from spreading. So thank you, Robin.